Hi, I'm Mitchell Coplin, and this talk is about extraction of LVEF from medical chart text to improve patient outcomes. We utilize AWS and Amazon Medical Comprehend. So what is LVEF and what is heart failure? Heart failure is a chronic disease where patients' heart muscles don't pump blood as well as it should. Heart failure is the leading cause of hospitalizations in the US. Left ventricular ejection fraction, or LVEF for short, is an essential metric for heart failure patients and measures how well your heart pumps blood. In a normal healthy patient, this is generally in the range of 55 to 70%, but can be much lower in sick patients. The problem is that this LVEF metric is often buried within the free text of clinical notes. Studies have shown that if you have clinicians manually review these notes to extract it, it can actually lead to a 47% increase in missing billing codes. And 27% of those patients with missing billing codes were eligible for cardiac implantable electronic devices, which you can see an image of on the right. These devices may result in life-saving care. Identifying and treating these patients would lead to improved patient outcomes and increased revenue for hospital system providing care. We utilized Amazon Medical Comprehend to extract the LVEF from medical charts. Our code takes an input medical image or text CSV. If you read through this chart, you can see that it actually says left ventricular ejection fraction of 51%. We are able to extract that data from many medical charts and then provide actionable analytics. All of our code is available on GitHub, and we utilize NLP pre and post-processing functions in order to further validate our findings. This is what the output of our code looks like. For this project, we processed 5,000 synthetic medical charts, extracted the LVEF values, and then provided actionable analytics information. On the left-hand side, we print out our findings where you can see that of the 5,000 charts, we identified 93 patients with LVEF values. The breakdown of these LVEF values can be seen on the right-hand side. They're broken down into mild, moderate, and severely abnormal LVEF results. Patients with moderate and severe findings should be checked to ensure they have heart failure billing codes tied to their encounter. Additionally, the 7 patients with severe LVEF may qualify for life-saving cardiac devices and should be reviewed by a clinician. If we extrapolate our findings to a larger health system, seeing 250,000 patients, we estimate that implementing this code in follow-up care could result in 40 patients receiving life-saving cardiac care devices. Furthermore, this would drive an additional $2.1 million of revenue for the hospital system providing care. On the right-hand side, you can see a confusion matrix and accuracy stats on our ability to extract LVEF. We had a precision of 97%, which is good because that means we'll send very few false positives for clinical review. Our recall was 63 and our F1 was 76%. We think these metrics would improve with better pre-processing functions. Thank you very much.